News 3 is taking action for your health this morning. The conversation about mental health is really opening up, and this week is a good time to talk to your doctor if you or someone you know may be struggling with depression.
Thursday is National Depression Screening Day, and our medical expert, Dr. Ryan Light from TPMG at Greenbrier Family Medicine, is here with us this morning.
So, Dr. Light, we know that conversation about mental health has really opened up. How many people is depression impacting?
Well, when we look at America, there's 16 million Americans annually that are suffering from depression. So the likelihood of having an episode of depression in your lifetime is about 1 in 6. So 1 out of every 6 has a problem with depression.
That is a lot of people. When we're looking at signs and symptoms, what are we talking about here?
Well, when we look at depression, we often think of sadness or depressed mood, but we also can see lack of interest or pleasure, fatigue, sleeping too much, sleeping too little, eating too much or eating too little, so weight gain, weight loss come in there. Difficulty with concentration, irritability. We also see feeling worthless. But in the elderly, we sometimes don't see that depressed mood or sadness. We see the other symptoms.
And you look at that list of symptoms too, that is something that we could probably identify in ourselves and in a lot of people.
It goes along with a lot of diseases that we see out there.
So what do we need to do? How do we need to take action? How can we get screened?
Well, you could talk with your primary care provider. They could provide that screening. However, if you're concerned about that, there are lots of online tools out there that you can use, and if any of those come back positive, then you want to follow up with the provider to discuss the treatment options for it.
Now that's you taking this step for yourself, but what if maybe someone you know is having perhaps more serious thoughts and you're seeing those symptoms in other people?
Well, there's lots of hotlines out there that can help us in crisis hotlines. One of them is the National Suicidal Prevention Lifeline, which is 1-800-273-TALK. You can use that one. The Community Service Board in the area is in local communities, and you can call them. You can always ask the ER. There's the Virginia Beach Psychiatric Center. And if you're unsure what to do, contact your primary care provider about concerns for yourself or others, and they can help guide you through the process.
I know the issue for a lot of people have is just the stigma and being too afraid or too ashamed to try to get help. And I think the key is we have to let people realize that this is a medical condition. Just like if you broke your leg, you would go to a doctor. It's the same thing.
I often say that if you had hypertension, you would want to treat it. And the same thing goes with depression. If you have depression, you'll want to treat that as well.
All right, and as you've seen there, you're not alone.
Such an important message. Thank you, Dr. Light.